Okay, so my name is Stephanie, and I'll be preparing IV medication through piggyback. So what I start off with doing hand hygiene, and I've collected my supplies. So I have my medication, my needle and syringe, my piggyback, my secondary tubing, pair of gloves, and alcohol. So I'm going to start off by comparing my patient's medical history to their prescription. I'm just looking for if my patient has had any allergies in the past that the medication can cause an allergic reaction. The patient has no allergies and his medical history is pretty clear. So now I'm going to compare my patient's prescription against the MAR, and I'm looking for the correct dose, the correct route, the correct medication, the correct time, and I'm making sure I have the correct client as well. So now I'm going to compare my medication against my patient's my medication and my dose against my patient's MAR, making sure that, again, I have the correct medication, I'm giving the correct dose, and I have the correct client. Alright, so all good from there. So now I'm just going to calculate my infusion rate and my medication. So I know that I'll be giving a 15 milliliter piggyback. My tubing is 10, and it'll be over 15 minutes. So that comes out to 33 drops, which is approximately 2 drops every 15 seconds. And while I'm here, I'm also going to calculate my medication. I know that my order is for 250 milligrams, and that my vial for every 250 milligrams, over 400 milligrams, which is in my vial, for 10 milliliters. So that comes out to 0.6 milligrams of medication. So now I'm just going to go into my patient's room and do a set of vitals and introduce myself to my patient. Hi, my name is Stephanie. Can you please tell me your name and date of birth? And he's telling me his name is Tutu, January 1st, 1936, and I've compared that to his armband. Mr. Tutu, do you have any allergies? He doesn't have any allergies. So now Mr. Tutu, today I'm going to be giving you some Gravol through your IV because I understand you've had an upset stomach. Is that okay? So I've explained, and I've asked his permission to give him his medication. So right now I'm just going to put on my gloves. And assess the IV site for any irritation or redness. There's none. He is good. So now I'm just going to compare my medication against his armband, making sure that I have the correct client again. Mr. Tutu. Okay, so now, Mr. Tutu, I'll be right back. I'm just going to go and prepare your medication. So now I'm just going to start off by cleaning my vial with alcohol. And I know I have to take out 0.6 milliliters, so I will expel 0.6 milliliters of air into milliliters of air into my vial. And I will withdraw 0.6. So I also confirm that I have the correct medication, the correct dose, correct route, correct time again. So I clean my piggy back. And insert the medication. Dispose of my needle. Gently agitate the medication. And place my medication label on the back of the medication. So I confirm that I have the correct medication in the correct piggyback and for the correct client again against the mark. So now I'm just going to go into my client's room with my secondary tubing, dispose of everything I don't need. Okay, Mr. Tutu, I'm back. So I also confirm, making sure I have the correct medication with the correct client again before I even set it up. Correct patient, correct medication. So I'm going to start off by just placing this over here. Gather my secondary tubing. So I'll clean. My part with alcohol. Make sure that it's locked. Move the tip. I'm just going to prime my secondary line with the normal saline. And I'm just getting rid of any air bubbles. There's no air bubbles. So now I'm just going to spike my medication bag, my piggyback, making sure that this is locked, and avoid touching the tip because this is sterile. So I've spiked it. I'm just going to raise my bag. So now that I know my drip rate, my infusion rates, I'm also going to be doing that. So I'm going to be watching this one, making sure that I can get 2 drops every 15 seconds. And I'm controlling it with my primary tubing. Making sure that this is opened as well. Okay, so I've gotten my 2 drops every 15 seconds. and 2 drops every 15 seconds. Okay. So now I'm just going to assess my patient again. Right, Mr. Tutu, I would stay with him for about 15 minutes just to make sure that he's not having any allergic reactions to anything. He's fine, so I will remove any of the supplies that I don't need, and I will go and document on the MAR for the correct dose, time, the correct medication that I gave him as well. Thank you.